Still forgetting what P wave, QRX complex and T wave actually means? Or do all the ECG waves look exactly same during exam? Don't worry. In the next few minutes, I will help you remember entire ECG chapter using simple visual stories, flow charts and memory tricks like this. Leads, axis, heart blocks, myocardial infarction, electrolyte changes and interpretation steps. No mugging up. Just remember these pictures and your brain will remember the physiology. This is my favorite memory trick. Do not memorize definitions. Remember the story. P stands for prepare. The atria are preparing by depolarizing. Next comes the QRS. Think squeeze. The ventricles contract with full force. And finally comes the T. Think take rest. The ventricle relax and recover. So the entire ECG become prepare, squeeze and take rest. Now let's connect these waves into one continuous journey. Now imagine the electricity traveling through the heart. First, the electrical impulse begins. The atria become activated. That's your P wave. Then comes a small pause at the AV node. That's why we have PR interval. This 0.13-second wait allows ventricular filling. Next, the ventricles depolarize, that the QRX complex. And finally, the ventricle recover, that is the T wave. Instead of separate facts, think of it as a one journey. Impulse, atria, pause, ventricles, and recovery. Remember this story, not the definitions. But how do we remember ECG leads without confusion? Students often think leads are difficult. Here is much easier way. Imagine the heart is a movie actor and the ECG leads are simply cameras filming that actor from different directions. Lead 1 watch from one angle, lead 2 watches from the another and lead 3 watches from the third angle. Now remember the examiner's favorite point. Lead 2 is the most commonly used lead. Why? Because it aligns the best with the normal direction of the heart's electrical activity. So don't think of wires, think of cameras. Heart as an actor and leads as a cameras. Next comes the topic that scares almost everyone, electrical axis. Forget complicated angles. Imagine a compass. The blue arrow is normal. If it moves towards left, it is left axis deviation. Think of left heart problem. Red arrow is abnormal. If it shifts towards right, it is right axis deviation. Think of right side problem. Remember the direction, then the diagnosis. So, LAD is left problem, RAD is right problem. Now let's learn how ECG itself gives clues about different diseases. This slide is a pure exam gold. Instead of memorizing every disease, remember these four visual patterns. High potassium shows tall tented T wave. Low potassium, hypokalemia, U wave appears. Myocardial infarction today, ST segment elevation. Old myocardial infarction, deep Q wave. Remember, today's heart attack, ST goes up. Old heart attack, deep Q wave remain as a scar. So again, we'll revise high potassium, hyperkalemia, tall T, hypokalemia, U wave, acute MI, ST elevation, old MI, Q wave. So let's finish with one page that can revise the entire chapter. If your exam starts in next 5 minutes, revise only this slide. P means prepare, QRS means squeeze, and T means take rest. Lead 2 is the most commonly used lead. LAD means left axis deviation, RAD means right axis deviation. MI, current MI is ST segment elevation, old MI is deep Q wave. Electrolytes, high potassium, tall T wave, low potassium, U wave. And whenever you come across any ECG and you have to interpret it, remember these 5 steps: rate, rhythm, axis, hypertrophy, and infarction. If you remember this slide, you can recall 80% of ECG answers in your exam. Congratulations, you just converted an entire ECG chapter into a handful of easy memory tricks. If you want to understand every concept in detail and learn how to write a topper style 10 marks university answer, watch the complete ECG main video. And if your exam is tomorrow, don't miss the 5 minutes ECG rapid revision video link on your screen. Keep learning with Physio with Neo and all the best for your MBBS exam.